Interviewing. Let's talk about menstruation. There are several areas of inquiry that can help to differentiate the diagnosis in women. The length, regularity, quality, and quantity of her menstrual bleeding, pain associated with the cycle, physical and emotional changes during the cycle, irregular bleeding during the cycle. Inquiry must also be made into a woman's gynecological history, the age she started to menstruate, whether there have been any births and pregnancies, and if so, how these were, whether there are any complications and problems, whether there were any symptoms that arose concurrently or immediately afterwards. Inquiry must also be made into the use of contraception. Many forms of birth control can cause imbalances in themselves. Furthermore, the use of the contraceptive pill or the coil will directly affect her menstrual cycle and bleeding, and this must be taken into account when considering her replies. If she is menopausal or postmenopausal, she should be questioned about when her menstruation ceased and whether there were any discomforts associated with it. Finally, inquiry should be made about discharge from the vagina. The information obtained about the menstrual cycle as well as the gynecological history in general will be relevant not only to the specific diagnosis of gynecological imbalances, but also to the diagnosis in general. It is said that women are more difficult to treat because there are so many changes in their physiology and in the balance of yin, yang, qi, and blood throughout the menstrual cycle. On the other hand, women are easier to diagnose precisely because of these fluctuations during the menstrual cycle, and the menstrual cycle and bleeding will act as a barometer for the whole body. Asking about the menarche, the first menstruation, can give some indication of the woman's fundamental constitution. If she has never had a menstrual bleeding or if she had her first menstruation at a late age, it will be a sign of one or more imbalances. A girl should begin menstruating at the age of 13. A woman's Jing cycles are 7 years long. The first Jing cycle starts in utero, so a child is, in fact, 1 year old when born. The menstruation should start at the beginning of the third cycle, example, when she is 13. If menstruation does not start at around this age, it could indicate that she is Jing deficient or blood deficient. Example, there is a lack of substance to create bleeding. It can, though, also be a sign that there is a stagnation preventing the flow of the menstrual blood. Inquiry into pregnancies and births will give an idea of the state of her Jing. If there have been complications during pregnancies and births, this can indicate that there may be kidney deficiency, spleen deficiency, heat, chi stagnation, and so on. Repeated and frequent abortions, miscarriages, and births can weaken a woman's Jing and blood. On the other hand, a woman who easily becomes pregnant will have strong Jing and blood. If she has had difficulty becoming pregnant, it can indicate Jing deficiency, blood deficiency, dampness and phlegm stagnation, qi stagnation, heat, cold, kidney yin deficiency, or kidney yang deficiency. Infertility is due to the following: a lack of potential, Jing deficiency, a lack of activation of this potential, yang deficiency, or a lack of nourishment to the fertilized egg or embryo, qi deficiency or blood deficiency, the nourishment being blocked by some form of stagnation, dampness, phlegm, chi stagnation, or blood stagnation, heat that agitates the egg so it does not unite with the sperm, or the fertilized egg does not settle and attach to the wall of the uterus. If the woman has miscarried several times, it can be a sign that there's kidney or spleen chi deficiency. But heat is also a possibility. A very rough rule of thumb is that if she miscarries in the first trimester, it can indicate kidney Jing deficiency. This will correspond to a genetic defect in the Western pathology. And if she repeatedly aborts in the final 2 trimesters, it is either kidney chi deficiency, which is the kidneys failing to control the opening and closing the lower orifices, or a spleen chi deficiency where the spleen failing to hold things up and in place. Thank you for your attention.